Well, Dr. Eric Smith, great to catch up with you again. Now, let's talk a little bit about the weight loss options that you take care of.
So there's a variety of options that we offer. There's an intragastric balloon, where we go and place a balloon inside the stomach to basically just cause patients to feel full quicker.
Is that a permanent solution?
That's a temporary procedure. And so they have the balloon placed. It takes about 10 minutes to place it. It's there for 6 months. And then they come back 6 months later and we remove it. It takes about 10 minutes to remove it. And under just some mild sedation, no incisions or anything like that.
Okay, is that after they've lost the weight?
So the balloon, the FDA requirement is the balloon is placed and it has to be removed after 6 months. So this is how I explain the balloon to patients.
Yes.
It's like taking a test. The balloon is your books. During that 6 months while you have the balloon, you're studying and learning how to eat the right way.
Oh.
Because it's teaching you how to feel full quicker. Cindy, our dietitian, is teaching you how to get full on the right foods. When we remove the balloon, now you're taking the test. So for the next 6 months, you still follow up with a dietitian every week or two to go over your food, and now you've learned how to portion control with the right types of food to get the weight loss.
That sounds really a simple solution.
Yeah, and that's a start.
And non-invasive.
That is indicated for patients with a BMI of 30 to 40, so it's lower weight patients.
Okay.
And that is obviously a temporary procedure.
We're going to get into the BMI in just a moment, but one of the things that we also want to talk about is the gastric bypass.
Sure. So the other two procedures we offer is sleeve gastrectomy and gastric bypass.
Yes.
Those are permanent procedures. Sleeve gastrectomy is a procedure where we reduce the size of the stomach. Instead of your stomach being like a water balloon that expands, now it's like a long narrow tube that doesn't expand. Gastric bypass creates a small pouch, as well as we create some malabsorption so you don't absorb all the calories that you take in. And that's generically how those two procedures work.
Okay, interesting. Now, anyone who's been to a gym and signed up for a gym membership, the trainers or that initial consultation is, we need your BMI.
Right.
And then they type all this, I don't even know how you get to that.
Right.
So tell us that formula, and at what level of a BMI do you need to be considered for surgery?
Sure. So BMI is based on a chart. It's based on height and weight.
Right.
If you go to our website, we have a BMI chart on there. You could go online, you could Google BMI, and the chart's right there. It's really easy to find out what your number is. And then numbers are classified in the obese category, morbidly obese category, and on up. So if someone's BMI is above 30, they're obese, and that patient could even consider something like a balloon. If your BMI is 35 or greater, that's when patients would become candidates for more of a permanent procedure, such as a sleeve gastrectomy or gastric bypass. In addition to that, if they have other medical problems that are typically caused by obesity and can be reversed with surgery, such as type 2 diabetes, sleep apnea, hypertension, hyperlipidemia, on and on, those are further indicators that a patient should consider surgery.
Well, everyone sitting at home always wants to know, Dr. Eric, we always do lots of before and after shots, but what is that typical weight loss goal for someone with these surgeries?
Okay, so if you take a balloon, the average weight loss after a year, so counting the 6 months when the balloon's removed, will be anywhere from about 30 to 75 pounds.
Wow.
Okay, that one they look more at pounds because those patients are lower BMI. If you take sleeve gastrectomy and gastric bypass, at 2 years, you can expect to lose, if you're compliant, you do the right things, you can expect to lose about 70 to 75% of your excess weight. So if someone's 300 pounds and their ideal body weight's 150 pounds, then they're 150 pounds in excess weight. And so they can expect to lose about 75% of that. Now, that's the average person. So I have patients who've lost 95% of their excess weight in 8 months because they've worked really hard, they're exercising, and they're very strict with their diet.
Very quickly, I do want to ask you, because there's a conversation going on, does insurance cover these procedures, and how does that quickly work?
Yeah, so a balloon is not covered by insurance.
Yes.
Obviously, it's a lower cost because it's a temporary procedure. Bypass and sleeve are covered by the majority of insurances.
Perfect.
And we also have financing programs to help patients if they don't have an insurance.
Well, as always, my friend, great information. Looking forward to seeing more results throughout there. If you want to find out more information about Dr. Eric Smith, Georgetown Bariatrics and Advanced Surgical Services, all the information is up on your screen. Head over to their website. They have great information, and also very important, that BMI calculator. Back after this short break, everyone.